Hello and welcome to Hadassah on Call, New Frontiers in Medicine. I'm your host, Maayan Hoffman. We often talk about those who were killed or taken captive in the war. But what about the survivors? The soldiers who fought bravely and came home with life-altering injuries? The civilians who escaped the massacres but lost limbs, their ability to walk, or even to perform the simplest daily tasks? Their battle didn't end on October 7. It's only just begun. Not long after it opened, I visited the Gandel Rehabilitation Center at Hadassah Mount Scopus and was struck by the incredible work being done there. Israel was already facing a shortage of rehabilitation facilities, but now, in the wake of the war, the need is overwhelming. Gandel is filling a critical gap, helping survivors rebuild their lives. In this episode, we go inside the world of rehabilitation, what it really means, how recovery goes beyond the physical, and why this work is essential for Israel's future. You'll get to hear inspiring stories of resilience and hope, and why I'm so proud to be associated with Hadassah. To discuss the matter, we have with us Dr. Elior Moreh, head of the Department of Physical Medicine and Rehabilitation at Hadassah Medical Organization. Welcome, Dr. Moreh.
Hi. Thank you for having me.
Of course. Now, I just want to get started with the basics, which is the definition of rehabilitation.
So rehabilitation is the process of regaining maximal function after an injury or a disease that made a change in function. So what do I mean by function? The ability of dressing by itself, going to the toilet, or just walking, ambulating. So it can happen following many diseases. It can be a stroke, of course, or a car accident, or head injury, spinal cord injury, or a war injury, obviously. So anything that changed the functioning of a person creates the need for rehabilitation.
Now, you mentioned the war. Obviously, since October 7th, things have looked very different. I know Gandel actually opened after the war. Tell me about what the doctors are seeing and who they're treating since October 7th and how that differs from what you saw beforehand in just the general rehabilitation departments.
Well, it's been a huge change, of course, because our regular patients, I would say that the average age is about 50, and half of the patients were with strokes. And now patients are, after war injuries, the mean age is maybe 21. And there are, very young people in a great shape before the injury, and they just sustained injuries to their limbs, usually, because they have a helmet, and they have a vest, and a ceramic vest that protects their torso. So the injuries usually are in the limbs, the upper limbs, lower limbs, with either bullets or shrapnel, all kinds of explosions and explosive devices that just made enter all kinds of harming particles to the limbs. So usually there are shattered fractures, and then there is accompanying nerve damage. So, for instance, a very bad fracture of the humerus of the arm, the bone of the arm, and a radial nerve injury, meaning that the wrist is dropped. They cannot raise their wrist, and then the hand is not so functional at this point. So you have bad wounds, so very infected wounds, and with all kinds of gaps. I won't enter into too much detail, but anyway, so we had all the complexity of taking care of the emotional side, of course, psychological side, and the wounds and the fracture and healing, which means recovering range of motion and strength in the hand.
So give me an idea of how many patients you're treating in a typical, let's say, week or month, and also how long the typical patient stays in the center, with the center.
So since we moved to the Gandel Rehab building, we have doubled our capacity. So we have 72 inpatient beds, and we have a daycare, outpatient center in which approximately, I think 220 patients come a week, and they come twice a week or 3 times a week. And about half of them currently are soldiers. Yeah, because it's long-term treatment. So
And define
can
long-term
take.
for me, though.
So the mean inpatient stay is 37 days, which is more than a month. So it's been such a huge change that we moved here because the conditions are so good and there's a lot of light and beautiful rooms for the patients. And it's either one patient per room or 2 patients per room. So it gives really incredible conditions. And in the outpatient, it can be like even 6 or 7 months of treatment. Of course, depending of what the patient needs. We always work with what we call functional goals, which means that we have a multidisciplinary team meeting every week or every 2 weeks in the outpatient place. And we set functional goals, meaning we think this patient could achieve walking for 500 meters next week. So that's the next goal to achieve. And we think he will be able to use his hand and dress by himself. Okay, so this is the next goal to achieve. And every time we continue, if there are functional goals to achieve, we keep the patient. If we think, okay, that's the maximal thing that we can achieve at this point, so it's about time to think of discharging the patient. And we prepare the patient for discharge.
Now, you did mention the mental aspect of the rehabilitation as well. Here at Gandel, are you treating the whole spectrum of rehabilitation from mental to the physical? And if so, what does that look like?
Yeah, sure. So it's always a very important part of rehab because, mind and body are one in the end. So, and motivation and good mood is very essential for a good rehab. It's a prerequisite almost. So, because if someone is depressed, he wouldn't achieve all he can achieve. So this is about rehabilitation. It's achieving all that a patient can achieve. Because of course, sometimes there is a substantial impairment and injury, and not always a patient can recover completely and be like before. But there is a rehab potential, and we want the patient to regain all this potential. And for that, like a balanced mood or not being totally depressed is very important. And the patients are seen by a psychologist from the beginning. For the war injured, we put in place a special system, really, with an emphasis on emotional support, and they would be seen twice a week instead of once a week by a psychologist from the first from admission until discharge, and also after discharge in the second place in the outpatient setting by the same psychologist. Meaning, why is it so important? It's because we want the person to really feel safe and not to have to open up to someone else. So it can be like 8 months of treatment with the same psychologist. And we also, as a team, got a special like short education program about how we should talk to patients who sustain difficult things in the battlefield. Should we ask all the questions? Should we encourage the patient just to talk and talk or not? Maybe it's better to do it in a protected setting. And of course, as almost always, it depends on the patient. So you just feel how you have to talk to the patient.
Makes sense. I mean, with regards to the need for rehabilitation, I mean, I'm assuming that some people come in, they start rehabilitation, but maybe don't finish it, or someone has a surgery and doesn't stick with the rehabilitation. How integral is it to ensure that you complete your rehabilitation program for the long-term success and ability to
Yeah,
achieve
that's
your
a very
goals?
good question. So often, especially with the patients from the war, we have this back and forth movement, meaning that sometimes we see that this special nerve damage requires an operation. So we send the patient for surgery, and then the patient comes back. So we just are. Our advantage in Hadassah is that we have very good relationships with all the different departments. It's such a huge hospital, and we have all the specialties needed. So we just, as doctors and as medical teams, we have very good relationships with the other departments, and we are just in touch. And then we look, we're just arranging that the patient will come back. And usually they want to come back because once they've been here, usually they are very eager to stay here.
It's a nice place to be.
Exactly. So usually our problem is more about discharging people than having. We don't have to convince them to come back here. Usually, if they have been here, they want to come back. So,
are most of the patients people that are living in the Jerusalem area, or are they from all over the country?
Most of them are from Jerusalem area, but Jerusalem, is the largest city in Israel, so it's a million people population in the city. And then the area is also huge. So there are people from Tzur Hadassah, from Gush Etzion, from Modi'in. So it's the whole area.
So Jerusalem and the surrounding area. When it comes to receiving this rehabilitative care, the team here, you mentioned the multidisciplinary team, or you're working throughout the hospital. What about in their personal lives, parents, caregivers? How do they get involved in the rehabilitation process?
Yeah, that's also a very good question. So the family is so important for rehab. In the mornings there are the treatments between like 8 a.m. and 2 p.m. The treatments take place. So it's physiotherapy, occupational therapy, sometimes speech therapy, psychology, social worker, nursing treatments, and medical visits. So it's a lot of treatments to have. So people are very busy here. So often they're not in their rooms, and it's very good. We don't want them to be in their rooms. But then the turn for the family come. So they come to visit either from 2 p.m. and later, and also they can accompany the patients in the treatments. And we tell the families what they are allowed to do. So if in the beginning a patient is not allowed to move from the bed to the wheelchair by himself, and then or to walk with a walker alone, at some point we allow the family to walk with them, and then we encourage them very much to walk with the family so that they can practice, because it's all about practice.
And ultimately, I guess they're going to have to be doing that when the patient eventually is discharged from
exactly. Yeah. We also encourage people to take the patient at home for Shabbat. So as soon as they are able to, they go on Friday afternoon home and they come back on Saturday night. And it's very important for us because, first of all, it gives a very good feeling to the patient. It reminds him that or her that the hospitalization is temporary, that they have a home, because sometimes people forget it. Like people feel they're doomed to be here. So when they go home for Shabbat, they feel that, okay, it's temporary. I have my home and I have all my centers of interest, and they can just, they suddenly realize that it's just very temporary. And also they see what was difficult for them at home. So they can come back and tell me, the bed is not the same height, and I couldn't get out of my chair, and things like that. And then so it's very important so that they can practice these things at the hospital when they're back.
It's really very interesting. You don't think about that picture that they could learn how to get up and down from the bed here, but then they go home and the bed is 3 inches higher, and now all of a sudden they're not able to do it. Yeah, and you have to be able to push themselves. Now, we talked a lot about the people who came out of the war, the soldiers, but as you mentioned before, October 7th, there were patients still being treated in these hospitals and getting rehabilitation. Thinking about older patients, what are some of the main or the classic reasons that someone over the age of 60 would end up at the Gandel Rehabilitation Center here?
Yes, so we have, of course, strokes, which are very common after the age of 60. And then people usually are paralyzed in half the body or have difficulty talking. We have, of course, falls and fractures of the neck of femur, usually of the hip, and which just a hip fracture can be a life-changing event for an elder person. And sometimes we have also tumors, brain tumors and all kinds of cancer rehab. That's the main reasons usually.
What are some of the misconceptions that you think people have about rehabilitation?
Well, there are many misconceptions about rehab. one misconception is that you just have, to give time to people and they will heal. So of course, time is very important. Time is a key question in rehab, but it's not that time will heal everything, because so many bad things can come in between. So a huge portion of rehab is about preventing complications. For instance, if I would just, I don't know, pay someone, and tell the person that she would be ventilated for 3 months. Okay, I will just, I'm doing an experiment, and this person would lie on her back for 3 months and be ventilated and get food, I don't know, in an IV or something. When this person wakes up, she wouldn't be able to walk, and she would have a terrible impairment in range of motion, meaning that the tendency of our tendons is to get very short. So then the person is like this, So, and it could be irreversible for 3 months, from 3 months of immobilization, because all our tendons just get stiff and short. And this by itself can just hinder the ability to walk or to use the hands. So a lot of rehab is just to do this stretching and preserving range of motion. And if you don't do it on time, it will be too late. So then maybe we will be able to repair it, but it would take surgery and a lot of pain and difficult treatments. So it's not about healing. It's about a set of things that we have to do during the healing process, because it's true that the body needs time, but there are lots of things to do and lots of things to prevent. Okay. So that's one misconception. The other misconception, I think, that often can be a challenge, is that it's all about will, and motivation. So, of course, motivation is so important, but sometimes motivation cannot do everything. So you also have to realize at some point that life has changed, and it won't be like before. So sometimes, and it's my job as a rehab doctor to tell the patient what we expect. So maybe I won't tell the whole truth at the beginning. It's a process of adapting to the new reality and to understand what can be done and what is out of scope. So my job is to disclose the news, and at some point to do what we call a family meeting and tell the patient, look, this and this and this, I think you will achieve that. But other things will be different now, and you have to adapt to it. And it's a process. It's very difficult to adapt for it. And some people, I had this patient, traumatic brain injury patient, is 5 years after the injury, and he came to my clinic last week, and he had just a ski accident and very severe traumatic brain injury. And he would tell me, look, my motivation is in the sky, but reality doesn't fit. So, and I was trying to explain to him that sometimes motivation 5 years after is not enough, and he has to do some changes. He wants to work as an engineer like before, and he doesn't want to do any even small changes. And he told me motivation is what brought me here, because I've achieved so much. People told me I wouldn't walk, I wouldn't do this and that, and now I'm walking and I can use my hands. Yeah, so it's beautiful. Motivation is beautiful, but sometimes you have to tell the patient, this is what you can achieve, and you have to do slight changes in your life and accept the new reality.
Are there any times, though, that miracles happen? Do you have any, obviously anonymously, but stories of where you really thought maybe this person wouldn't be able to achieve the goals, but they did?
Of course, I see many miracles. And I always tell patients, I'm for miracles. I want miracles to happen, but I work meanwhile with reality. It's two streams. It's two different streams that we have to work on, because rehab is always about compensating for things that for now you cannot achieve, and restoring function. So it's two different streams that we work on in parallel. A miracle story. So yeah, I've seen many miracles in fact, but I've seen lots of inspiring story. I will tell you the story of a young soldier He's 21-year-old, handsome, very nice and funny guy, soldier, and he had something exploded just in his hand in Gaza. So he had a very bad injury of both his hands and partial amputation of fingers in one hand, in the right hand, so the dominant hand, and very bad fractures in the left hand. And of course, wounds, very bad wounds. And he was hospitalized here. And picture this guy, 21-year-old, who isn't able to use his hands at all. So he can walk on his feet, but he cannot eat, he cannot dress, he cannot go to the bathroom, forgive me. And it's so difficult. And more than that, he was not able to look at his hand. It was so difficult for him to look at the amputated fingers. And it just, every wound dressing change would take about 2 hours of convincing him and doing it so gently with a playlist of music, very nice music that he liked. And, all the doctors were there and the nurses, and were trying to make it as gentle as possible. And he wouldn't look at his hand. And so much that he just started developing like a short neck muscle. He was like this because he wouldn't look at he didn't want to look at the right hand, so he was looking a bit to the left always. Yeah, it was very extreme. And I would tell him, hey, look, if you continue that way, your neck wouldn't be symmetrical anymore. You have to be more, I don't tell you to look at the open wound, but just, keep your neck normal. So in a normal place. So with a lot of treatment and time and psychological support, and the whole team being very gentle with him, he, in the end, everything, the fractures in the left hand recovered, and the wounds got closed and not infected in the right hand. And now he recovered complete function of his hands, and I see him downstairs in the occupational therapy sessions, and he's happy, smiling, always very positive. And he has now just special treatments that we give people for scars, but he's using his hand and looking at it, and he's gone through a long thing. And he had, of course, issues before that, because I don't want to get into details, but the last fingers reminded him of a personal loss of a loved one. So it's always intricated. We're human beings. We have a history. We're never a blank paper sheet. So
sure, and everything's tied together 100%. Now, the Gandel Rehabilitation Center opened in the middle of the war. And I know that there was already quite a shortage of rehabilitation facilities in Israel even before October 7th. Can you talk just a little bit about the impact of having this facility available since the war started, and the difference it's made in the overall treatment options in the state of Israel?
Well, sure. So the number of beds in the Jerusalem area was almost the lowest in the country. So it was way below the norm.
And that's after you said that we are the largest city in Jerusalem.
Exactly. So we were really lacking beds, inpatient beds, and facilities for rehab. And if I can say so, it was a chance that the Gandel building was planned to be opened, because it was supposed to open a year later, but we already started recruiting people. So when the war began, we already had doubled the number of psychologists, the number of physical therapists, the number of doctors, So we were half prepared, let's put it that way.
And you fast-tracked it to open it up earlier?
Yeah, it was incredible. Everyone worked so hard, and in Hadassah and Hadassah Women Organization, and everyone, also the government, there were a lot of aids, and we managed to just hasten up the work here, and we would visit here, and there was nothing, it was like a work construction site, but people just worked 24/7, and it opened on January 16th, so 3 months after the war, instead of almost a year later. So it was incredible. And yes, it has changed. It has changed a lot, because we have much more place. We have beautiful rooms for treatments, And we already had, the best technology and incredible state-of-the-art advanced technology, the anti-gravity and the Locomat robot and a robot for the hands in occupational therapy and computerized state-of-the-art cognitive treatments. Lots of incredible things, but now we have so much room. So yeah, it has changed the conditions of the patients very importantly.
Yeah, and one of the things I actually wanted to ask about was technology and new treatments. First of all, how Israel in general stands up to the rest of the world in terms of that kind of innovation, and specifically, of course, at Hadassah, if there are unique technologies or unique opportunities that you're being able to offer the patients.
Yeah, so we have really state-of-the-art equipment, and as always, Israel, startup nation, so on. So we do use some special robotic devices that have been developed in Israel, like the Rewalk, which is an exoskeleton, which enables completely paralyzed persons to walk. And we also do research here with the Gait Lab. We have a Gait Lab, which enables us to assess which is the specific problem that prevents a person from walking symmetrically or in a more efficient way, energetically speaking. So it's a lab in which there are cameras in 3 dimensions, and you put infrared markers on the different joints. I think you're a runner, no?
Yes, I don't know how you know that, but yes, I am a runner. Yeah.
So you understand that. So every little movement can make a different movement can change all the energy, all the efficiency of walking. So it's very important to us to put all these markers on the joints and to get computerized output of the difference, like what are the angles in each limb, in the knee, in the ankle, in every step of the gait of the person. And then according to that, you can personalize a treatment. Say, okay, he needs Botox injections to the knee, which is not
It's not to make it look smooth and
no, it's not. You use a lot of Botox here, but yeah, we call it botulinum toxin. But it's the same substance that people put in their face. We inject it to knees or to ankles, usually in neurological patients, after a stroke or head injury, and then it relaxes the muscle, and range of motion would be improved, and it would improve the whole ability to walk, for instance. Yeah.
Super fascinating. So is there anything else that you want to add or that you think that people should know that we didn't talk about?
Yeah, I don't know. So I've talked to you about research. So our maybe vision is to go towards personalized medicine, personalized rehab. So I have done a PhD involving brain imaging. So what I started to do now is try to do some diffusion tensor imaging, which is an advanced brain imaging technique to many patients. And in my vision, I would like to do it to almost every neurological patient, meaning after a stroke or head injury. What this special research imaging technique does, it's not a normal MRI. You put a person in the MRI machine, but for a shorter time, not the 50 minutes that are usually required. It's too difficult, so I put them for 15 or 20 minutes, and then I get a special sequence in the MRI. It's called DTI, and it measures the diffusion of water molecules in the brain. And following that, I can, with the computer program, reconstruct the brain white matter pathways in the brain. So simply put, it means that I really can draw the path, like the roads in the brain of this specific patient. So I can see what is preserved and what is harmed, and correlate it to the patient's impairments, like to the phenotype, to what we see. Like if someone has aphasia, which is difficulty to talking, so I can measure which are the patient's problems while talking, for finding the words or repeating something or understanding speech, like what we call semantics or phonetics, and compare it to the specific tracts of the brain of the person and see what is preserved and what. And there are numbers also. It's not only drawing, it's also, so we can get figures and understand from there what is the potential, understand better what is the potential of the person and which tracts are more preserved and we should work on them. And then maybe it will help to recover function, So this is something that I would that we could do, and it's so advanced techniques. Like, it's not about a brain scan in which you just see the lesion. You really see it's very colorful, very beautiful. I can show it to you later. You really see what is happening in the brain of this specific patient, and it's incredible. It's something that we couldn't think of. Like 20 years ago, it was impossible to think about it.
So I know, piggybacking off of what you were saying, that there will eventually be a real focus on R&D here in the building. As we walked around today, we saw some of the floors are open, but there are still several floors that are not. Describe the vision and how that's going to change the way that we do business here at Gandel, how it'll affect everything.
Yeah, sure. So there are only 3 open floors at the moment. And the entrance floor actually is supposed to be the one for clinics and for a huge R&D center in which we will do research. We have, how do you call it? And innovation lab that will be with 3D printers and with just several labs that are planned to open there. And we will have 2 more inpatient wards in the 4th floor. And so we're not done yet. We're in the middle of the process actually, and we're just waiting for the building to be completed. And at that point, we will be able to receive much more patients. And at the current moment, there are still a quite long waiting list for rehab. So we are still lacking beds, and we are still not able to take care of everyone. So yes, there is a huge need for opening the rest of the floors, and we hope it will be soon.
Yes, so we'll definitely check back, in another year or so and see where things are holding, hopefully even before.
You're most invited. I would be delighted if I can show you already the new departments open. And I'm looking forward for the lab to be open because I also I am supposed to have a lab there, and I want to recruit some students. And it's just thrilling that we will have this place to continue what I've talked to you about, the personalized medicine and advanced brain imaging techniques. And we could apply it for other conditions, for instance, multiple sclerosis and brain injuries. And we also already started also a new program last year about processing of pain in chronic pain syndrome patients with pain in their hands or their legs. And we put them in the MRI, and we look and we can see that the processing of sensation and of pain is totally different in the brain. So it's really interesting because there are several pain conditions that are not understood at all in current medicine. And this will increase our understanding of how we can help with dealing with chronic pain, which is such a huge problem in modern society. So I think that if we can do that, it will have all kinds of repercussions.
Wonderful. Well, thank you so much for your time today.
Thank you so much for having us. And we are so happy, so excited about the Gandel New Center. And it's really a pleasure and an honor to be taking care of all these wounded soldiers and of all the patients in the Jerusalem area.
And I know that they appreciate it. Thank you.